Greetings. Dr. Mark Winton here from the University of Central Florida Department of Criminal Justice. And in this video, I'd like to present exposure to evil, post-traumatic stress disorder, secondary trauma, and burnout among criminal justice professionals. This has been a topic that I believe is extremely important to discuss in the program, and especially for those who are entering the field, but certainly for those who have been in the field for a while as well. For a while, I never talked about this in my classes. It wasn't until many years ago in my sex crimes course, a student asked after I presented a case if the cases I had seen when I worked on a child abuse unit had affected my mental health. And I didn't know how to answer it. It threw me. And so I thanked her for the question, got around it for the time being, and said that I would go ahead and put together some material and apologize for the deficit in the course regarding that area, and realized how important it was. So I had to pull my thoughts together, and the result was I made several videos and PowerPoints discussing secondary traumatic stress and burnout in the criminal justice field, and posted that not only in my classes but on YouTube so anyone could see that. Since that time, things have changed. One of the things that changed is the Diagnostic and Statistical Manual of Mental Disorders moved from the text revision 4th edition to the 5th edition. And so I had to update my notes, and this is an update of that video. I've also tried to combine several videos and make it a bit shorter, a bit more concise, if you will. So I'll have the links in the PowerPoint. I'll also post the links in the discussion or comment section rather below, so those of you who are not in the class can go ahead and obtain further information if you're watching this outside of the course. So to start with, I'd like to point out Dr. Stamm's work on secondary traumatic stress. Dr. Stamm developed the Professional Quality of Life Scale, and I have a link to that scale. You can download the manual. You can take the assessment tool. You see where you fall, and read about the research. Really a great deal of useful information in that manual and on the website. But to quote Stamm from the 2010 manual, page 12, I'll define compassion fatigue, secondary traumatic stress, and compassion satisfaction. So to quote Stamm, compassion fatigue breaks into two parts. The first part concerns things such as exhaustion, frustration, anger, and depression, typical of burnout. Secondary traumatic stress is a negative feeling driven by fear and work-related trauma. So there we have compassion fatigue consists basically of burnout and secondary traumatic stress. And burnout and secondary traumatic stress are different. And then compassion satisfaction is about the pleasure you derive from being able to do your work well, to quote Stamm in the text. So secondary traumatic stress is similar to post-traumatic stress disorder, and I think I'll go into a little bit more detail with post-traumatic stress disorder. And of course, some of those symptoms are what we see in secondary traumatic stress, which is exposure to trauma of others. And so post-traumatic stress disorder, though, to quote from the DSM-5, published in 2013 by the American Psychiatric Association, post-traumatic stress disorder is, quote, exposure to actual or threatened death, serious injury, or sexual violence in one or more of the following ways, end of quote. And then we have a list that includes experiencing traumatic events such as witnessing, learning about, or repeated exposure to those events. And those are all kinds of events we can see in natural disasters, in violent crimes, in child abuse and neglect, sexual assault cases, emergency responses to accidents and the like. And some of the symptoms then of post-traumatic stress disorder would be having distressing memories intrude, having or displaying avoidance behavior, trying to stay away from certain locations or situations that are related to the trauma, negative changes in thoughts and mood, alterations in arousal and reactivity. And the duration of the criteria above is more than 1 month, but please note that there is a diagnosis in the DSM-5 for acute stress disorder, which is 3 days to 1 month duration of the disturbance after exposure to the traumatic event. And then also there's clinically distress or impairment that the person displays, and a professional would also rule out other conditions, medical conditions or substance abuse, for example, as related to those symptoms. To kind of summarize post-traumatic stress disorder, we're talking about exposure and distress, re-experiencing the traumatic event, numbing and avoidance, and hyperarousal. So someone could have some or all of those symptoms. And so we also have to consider other issues that might occur in the field. For example, traumatic grief, comorbidity, which would be other mental disorders, substance abuse, depression, anxiety disorders, and the like, new stressors in a high-tech society, and also memory and traumatic stress. Those are all other areas really to explore and integrate into the whole discussion of burnout and secondary traumatic stress, which is sometimes called vicarious trauma. And some researchers say vicarious trauma and secondary traumatic stress are the same. Others say they're different. I'm not going to get into that debate right now. But some of the statements that we might hear from someone with post-traumatic stress disorder would be, for example, I feel like I'm going to explode. Time is standing still. There is no future. They took a part of me. I've been a prisoner of my mind. So those are just some of the statements that you might hear from someone. And then looking at comorbidity, I mentioned, but I have another slide that talks about other issues like medical conditions due to injuries, substance use disorders, depression, adjustment disorder, different anxiety disorders, including phobias, as well as panic attacks, and then sleep disorders and others as well. So a mental health professional, of course, would look at the big picture. And a lot of the stress related to all this leads to imbalance in one's professional and personal life. So there's an abnormal imbalance in that sense. And this can have devastating effects on the person's job performance and on the person's relationships and the person's physical and psychological health. Another thing is that post-traumatic stress disorder may not show up for years after exposure to the traumatic event or traumatic events. And post-traumatic stress disorder can happen to anyone at any age. Children have been diagnosed with post-traumatic stress disorder. And I think the important thing to realize, and this is, I'm going to read from the Diagnostic and Statistical Manual of Mental Disorders, the desk reference, the diagnostic criteria from DSM-5, a statement in here on page 143. This is part of post-traumatic stress disorder. Quote, experiencing repeated or extreme exposure to aversive details of the traumatic events, such as first responders collecting human remains, police officers repeatedly exposed to details of child abuse. So one could actually have post-traumatic stress disorder from hearing the stories of victimization. And I think that's really key and something that we're spending more time looking at. there's more discussion, I think, in our society about post-traumatic stress disorder or secondary traumatic stress. There's more attempts to integrate programs to not only identify but also to intervene and treat and reduce problems related to the secondary stress related issues. And of course, burnout can occur as well. Now, burnout, where someone becomes emotionally exhausted, doesn't like the job anymore, dreads getting up, going to work, and so a lot of people in different jobs will have burnout. But secondary traumatic stress is that the post-traumatic stress type symptoms resulting from being exposed to traumatic events. And so those are different. So you could have, for example, an insurance salesperson may be burned out on the job, but selling insurance probably doesn't create post-traumatic or secondary traumatic stress or vicarious trauma in that sense. Of course, unless they were exposed to a traumatic event. But I'm just trying to point out that there's, a difference. But you can see burnout and secondary traumatic stress, co-occurring. The good news is that there are some beneficial treatments, and Beeson in the book Post-Traumatic Stress Disorder, the article Post-Traumatic Stress Disorder from the American Family Physician in 2006 points out some beneficial interventions. For example, multiple session cognitive behavioral therapy. And there's several different types of cognitive behavioral therapies that may be useful. Also, there's a procedure called eye movement desensitization and reprocessing, EMDR, and that is something that a trained health care provider or mental health professional would do with someone and guide them through particular exercises. That's been shown to decrease the symptoms of secondary traumatic stress and post-traumatic stress disorder. And also there are specific medications that can help, and I'm not going to get into that because that's way out of my area. And I would mention that there's other innovative cutting-edge treatments going on as well. The University of Central Florida Psychology Department has a related post-traumatic stress disorder treatment program, and you can Google that from the University of Central Florida Post-Traumatic Stress Disorder Treatment Program, and they're using all kinds of cutting-edge techniques, including, for example, virtual reality. And so there's all kinds of new things and research going on as well. So there are many interventions that may reduce the symptoms of post-traumatic stress disorder and significantly help a person with that. So that's the good news to hear. The stress and strain leads to dysfunctional responses, and that can lead to psychological and physical changes that occur in the person. And that is from Bremner's book, 2005 book, Does Stress Damage the Brain? And it can, but also by getting appropriate treatment, it can be reversed, some of that damage there. Bremner also points out that around 25 to 50% of the population experience traumatic stress, and about 15% then develop post-traumatic stress disorder. So Bremner concludes around 8% of the population has had or has post-traumatic stress disorder. And also Bremner points out genetic and environmental factors may play a role in the development of that. Also, there may be effects on memory and identity and consciousness, and there may be a host of problematic coping mechanisms that someone uses to deal with the stress and strain. Rothschild, in an early article I found when I was putting together a seminar years ago, titled The Dangers of Empathy, Understanding the Keys to Vicarious Traumatization in the Psychotherapy Networker back in 2002, talked about that it can be dangerous to try to feel our client's pain and put it at risk of developing vicarious trauma. So we have to start asking ourselves, how do we process information that we hear from people who have been victimized, and how do we interact with them, and how do our own personal issues in our lives interact with descriptions of trauma. So I'll turn now to some practical applications, and Taylor just published an article. It just came out when I'm making this video. I'm making this video in October of 2021, and the article came out in October 2021. I have the link there for you. Building Resilience in Law Enforcement Through a Mental Wellness Program, published in the Journal of Police and Criminal Psychology. I was able to get that article with a link and read it without having to go through any special registration. Hopefully that still works, especially for those who do not have access to the university library. But I think, again, I read that and I was doing a literature review update for this presentation and looking at some of the innovative things. And so that was really nice to see, the progress that's being made, although somewhat, to me, it seems kind of slow, but it's being made, basically. Now, Taylor points out that close to a fifth of law enforcement officers may have post-traumatic stress disorder, while many have some of the symptoms. So that's a lot. That's a fifth. That's a higher rate than what was in the other statistic I presented for the general population. And so we have to consider the reality of that. And Taylor points out that mental wellness programs are important to mitigate the hazards that criminal justice professionals face on a daily basis, addressing both burnout and traumatic stress. And also we need to address and understand and intervene to deal with the high rates of suicide. That's very important as well. And criminal justice professionals, Taylor points out, may have several fears about seeking counseling. One, they may be worried about the confidentiality issues surrounding what they discuss. Two, they may be worried about being misunderstood by a counselor who may not have any experience in law enforcement or corrections or child protection work and emergency services. And, the fear is, will they understand what is going on? And third, fitness of duty for the job, worried about administrators finding out, their colleagues finding out, and that having a negative effect. Taylor points out the components of a mental wellness program include formal policy development, and the big one there would be having the law enforcement officer have an annual checkup with a mental health professional to make sure everything's going okay, and if not, to get appropriate referrals to get the help that they need. Also, administrative leadership is very important, not only to help remove the stigma of mental illness, but also to model getting help being something that is desirable to do, and also offering social support for all those who are getting counseling and going through programs. It's also important to have appropriately trained mental health professionals who have specialized in understanding law enforcement culture and understanding things, for example, law enforcement humor, which may be a little bit different than non-law enforcement humor, and also understanding some of the specific stresses and strains, and then having that in a structured wellness model where multiple methods are used based on the evidence of what works. So that is real important as well. Again, I think, for me, the wake-up call was that student asking me in front of 150 plus students if my work had affected my mental health, and if I, had problems sleeping or nightmares or, other issues. I had worked in Child Protective Services for a number of years in the earlier part of my career, and I worked specifically on the sexual abuse unit. I probably saw around 1,200 cases, and so I interviewed people that had been victimized and people who had perpetrated crimes, and often wrote reports for other agencies and for the court. And so I was exposed to this on a daily basis, hearing stories of people who had been abused, and I did that basically 4 years, and then started cutting back to part-time and working on graduate school, and then probably spent another 4 or 5 years or so in a much seeing much lower number of clients in a private forensic practice, and so all those experiences, I just kind of went through that, and then when that student asked me, I had to think about all those things, and that's why I was taken aback, because like, whoa, and I had to do some real searching and thinking about it, thinking about things I didn't want to think about anymore, thinking about cases, and I just wanted to get that out of my head, but it's still there. One of the things that I found helpful, what I used as a coping mechanism, was research, teaching, and writing, and ended up co-authoring 2 books. This is one of them here. This is our book, When Teachers, Clergy, and Caretakers Sexually Abuse Children and Adolescents, and wrote this book with a clinical psychologist. We split up the chapters and worked then with each other to integrate everything. And we put a chapter in there on burnout and traumatic stress from working in the field, because we thought it was so important. And we put in there some different things that might help at the individual, the family, the organizational levels. And so, having an appropriate support system, having, supervision available. And so looking back, it was interesting to kind of look at not only cases, but also interactions with the community and all that different stuff. We wrote a little bit about that in the book, but there's probably a lot more to get there. I mean, for example, I found that it was difficult for me to explain or talk about what I did every day when I worked on the sexual abuse cases. That you come home from work, and oh, what have you been up to? Oh, how was your week? What have you been doing? And so it was always, I really didn't say too much. I didn't get into any details or specifics. I didn't think people wanted to hear about it. I didn't want to talk about it, and so on. I don't think a lot of people I knew, even friends and acquaintances, really had no idea what I did. He's a counselor. He goes and talks to people and he comes home, and part of that may be. And then dealing with other agencies and organizations, and then the politics of it all of that comes into play. So now we have a whole new set of situations to contend with. When I was thinking about this, I was thinking, in the law enforcement area, that this has been going on, for as long as law enforcement has been going on, being exposed to traumatic events. Okay, that no doubt. But then I'm thinking in the last couple of years, there's been a lot of strain and stress between the law enforcement community and and the community at large, and we've seen that materialize. And then in addition, we have COVID that's been going on over a year now, and who knows when it's going to wrap up and end. And that certainly puts more stresses and strain on everyone. And so it's been a very, very different time. My fear would be that we see even more of secondary traumatic stress or vicarious trauma and burnout in the law enforcement field. And there's people that are doing research right now, and what's going on in your own agencies and in other agencies. One of the things that I've been impressed by is the leadership in some police agencies to make sure that their colleagues are taken care of, that they have access to mental health services, that they have access to training and programs, that they have an understanding of what these risks are. And probably one of the difficult things would be, and when I came back to try to talk about it to my students before making the videos, one of the things I said is that we go into the field not thinking this could happen, and that's probably a big problem. Is thinking that I am immune from traumatic stress, I am immune from burnout, and we're not. So to sum up, basically, I would say that it's extremely important to recognize that dealing with evil can be hazardous to your health, both physical and psychological, and certainly socially as well. But there are many programs out there, there's many treatments, and that's the important thing. The sooner someone gets the help, the better, and then it's easier to prevent early than later problems from occurring. And so hopefully we discuss this more, and we continue to innovate and work in this field. Thank you.